Here again on Ask Dr. Ferguson, both live on the radio and the internet. So those of you who are local and you want to catch us live on the internet, you can go to my website, which is askdrferguson.com. Right in the center of the page, there'll be a link that says Live Radio. Click on that. That'll take you to a YouTube page. On that page, you click in the top left-hand corner. There'll be a little house. Click on that house and then click on Feed, and you'll be able to catch the program live. This, if you don't want to try to do the radio and the television and the internet, because there's about a 30-second delay. So please join us on either place. We're happy to have you each week as we talk about something in the preventive health care realm. So how are you today, Bishop?
I am well, Dr. Ferguson, and trust that you are.
I'm doing great. Now, you were saying there was something they wanted to talk about. What was that?
One of the listeners wanted you to talk more on vitamin B.
Okay. Well, we can definitely do that. We've been trying to get rid of these vitamins for a long time now. We've had several programs where we've been talking about these vitamins and minerals, and hopefully we'll finish that up today and go on to another topic. But we've talked about this topic for several weeks now, and just again, as we're going to continue on the topic, I guess I need to hit with a real quick review. When you talk about vitamins and minerals, people say, well, what's the use? Why take them? What good are they? Vitamins and minerals help multiple things in your body. They help as enzymes, coenzymes, catalysts. And what are those words I'm saying? They help speed up the process of your metabolism, speed up the process of how you utilize foods, how you utilize different nutrients. That's what a catalyst does. A catalyst makes the process go faster. So, like, for example, if you put an egg in some warm water, it would take much longer for that egg to get fully cooked than if you put egg in boiling water. So the boiling water would be more like a catalyst, where the regular water, just the warm water, would not have the catalyst. And so vitamins and minerals can act those different ways in the body. Many times vitamins and minerals work together to do different things in the body. Minerals are what we call non-organic, meaning you don't create them. The minerals that you have are the minerals you've always had. They don't get destroyed. They just cycle through your body, in and out your body, into the soil, into the plants, from the plants back into the animals, or we eat the plants, and then the minerals are back into our body. So the minerals just kind of keep cycling, as opposed to the vitamins. The vitamins we call organic, so that's a substance that could get utilized in a different way. But we have essential vitamins and minerals that we have to take into our body. When we put the word essential there, that means we have to take it in. It means we're not going to just make it in our body, and we're not going to just get it in general, but it has to come from the outside. So that's what, when we use that word essential, that's usually what we're referring to. Your big vitamins that are soluble vitamins, you got your vitamin B's and your vitamin C's. Those are what we call water soluble. And then your fat-soluble vitamins will be your A, D, E, and K. Those will be the more common ones, although there are definitely more vitamins than the ones I just mentioned, but those are the more common ones that we talk about. So just as a point of review, that's kind of a basis. So when you talk about taking vitamins and minerals, you can become toxic on vitamins and minerals if you take too many, particularly the fat-soluble vitamins. That's your A, your D, E, and your K, because they dissolve in your fat. So if you have a lot of fat cells, that means you have more potential for becoming toxic on one of those, because you have more places where that vitamin can dissolve into the fat and kind of hang out there.
And when you say toxic, you really mean it can harm you?
Absolutely, yes. You could definitely take too much of those things. It's not easy to take too much of the vitamins and minerals, but you definitely can. And it's much easier to become toxic or take too much of the fat-soluble vitamins than the water-soluble vitamins. The water-soluble vitamins, as it says, water-soluble, so they're going to dissolve in water, and so they're going to come out in your urine, some of your stool, but it's hard to get too much of those because your body's going to eliminate it. Like sometimes people will take a whole bunch of vitamin C and their urine will turn oranges or dark yellow oranges. That's because you're putting out the vitamin C. So your body's going to put out what it doesn't utilize when you talk about the B's and the C's, because they're the water solubles.
Okay.
Where the fat solubles, you have to be more careful. Now, vitamin A, that's another one where you have to be careful. A lot of times I would suggest, if you're going to try to take vitamin A, people talk about being good for the eyes, things like that. You want to do it in the form of beta carotene. because beta carotene inside your body can convert to the vitamin A, but you won't become toxic usually on the beta carotene, whereas you can become toxic on the vitamin A. So that's a good little tip there for people to remember to do it that way.
Okay.
And again, at a point of review, when you take in vitamins and minerals, there's many differences. You have synthetic vitamins and minerals, you have natural vitamins and minerals. The natural ones are usually going to be better. The cost of the vitamins and minerals can vary a lot, and the cost is often related to how it's bound, the coating on it, meaning a coating that dissolves really easy is usually going to be the more expensive one because it's usually more expensive to produce. The coating that's bound really tight, they're usually going to be the less expensive one because it's easier to produce. And what happens, the point I'm making here, is if it's bound really tight, you may not ever dissolve it. So it may come out in your stool the same way you took it in your mouth.
So therefore, it has not done you any good?
It definitely hasn't done you good in that case. Potassium is one of those big ones that's in that category. A lot of times, my seniors, I have to end up putting them on a liquid potassium because they'll take a potassium pill and it comes out in their stool the same way they took it. And some of the vitamins and minerals could do the same thing. So you want to you want to test your vitamins and minerals and see that they do dissolve relatively quickly. The vitamins and minerals, the best ones are probably going to be with a health food store or with one of your multi-level marketing companies because they've had more time and energy to put research and development into those vitamins and minerals, and they usually have more of a gelatin coating, vegetable type coating, which would dissolve easier usually. So that's a generality, definitely not an absolute, but that's more likely the scenario. And you know, vitamins can range anywhere between $3 and $70. So you sometimes with vitamins you get what you pay for. Sometimes things are overpriced, but that's one of those things where you don't just want to reach for the cheapest thing on the shelf because it may not be your best one.
Okay.
The example I frequently give is vitamin E. You have a natural E and you have a synthetic E. Well, the natural E is about 75% more potent than the synthetic E. And it might cost more too. So you might see vitamin E 400 milligrams on the shelf, and one might be $3.99, the other one might be $14.99. It's the difference in those two probably is the $14.99 one probably has the natural vitamin D as opposed to the synthetic. So I encourage our listening staff and all that getting to get an understanding, and that's why I try to present this in such a way that it's understandable and that you can utilize the information immediately. So vitamins and minerals I think are very important. Even if your diet's perfect, you exercise every day, you're a healthy person, you're not stressed, not uptight, vitamins and minerals are still important because they're essential things that we need that you may not get from your food. Because again, your food has to come from the soil or from the animals. So if it comes from the soil, that means the plant or the fruit had to take up the vitamins and minerals from the soil in order to get it into the plant, in which then you then eat it. Well, if that soil is depleted of some of the vitamins and minerals, then obviously you're not going to have those vitamins and minerals that you need. The other generality just to point out here is just because something says it's greater than the recommended daily allowance, that doesn't mean a whole lot. The recommended daily allowances are based on how much of this vitamin or mineral do you need not to get a specific disease that we know of. So if we know that scurvy comes from vitamin C, and if you don't get at least 65 milligrams of vitamin C a day, you might get scurvy. A lot of times people crossing the ocean, a lot of times slaves got scurvy as they crossed the ocean because they weren't getting any vitamin C. And so what happens, you give them up to 65 milligrams a day, you can get rid of the scurvy. Well, I recommend 2,000 milligrams a day. So you can see that the recommended daily allowance is not, maybe it's a guide on the low end that you want to minimally get that amount, but it's definitely not a guide on the high end on how much you may need to function optimally. Does that make sense?
Yes, it does.
Okay. All right, so again, those of you who are listening to us on the radio, you can always go by my website and you can watch us live on YouTube. That's AskDrFerguson.com. You'll see live radio, little icon right in the center of the page. Click on that. That will take you to the YouTube, at which time you can click on a little house up in the top left-hand corner and then click on Feed. and then you'll be able to watch the program live. And we've been having more and more people join us each week. I don't know how many are joining us locally or how many are joining us from around the world, but the information is going to be good. It's going to be the same regardless of where you join us from. So we welcome you both locally and internationally. So yeah, let's talk about the B vitamins. That was kind of a question we started today with. So there's several B vitamins. The ones that we talk about more commonly are B1, B2, B3, B5, B6, B7, 9, and 12. Those are the ones we talk about more commonly. But B1 is thiamine, and thiamine is often deficient in a person that drinks a lot of alcohol. Particularly a person that's become an alcoholic, they've often become deficient in thiamine, and so that's one of the things we often give that alcoholic patient is when they see us, we often start giving them thiamine. 100 milligrams a day might be the dose for that particular person, but as the recommended daily allowance for thiamine is 1.5 milligrams. So you can see there's almost 100-fold difference there in the amount that I would recommend a person that's alcoholic as opposed to what the recommended daily allowance is.
Yes, it is.
So things like this can vary greatly. Riboflavin is a B2. Again, both B1 and B2 can help with energy metabolism. B1 can help more of the nervous system function. B2 helps more with maintaining your eyes in good work, in good healthy condition. And when I say energy metabolism is how you utilize the nutrients that are coming into your body to turn them into energy. So when you eat food, your body breaks down those foods into proteins, carbohydrates, fats, and then your body utilizes them to keep functioning. It's like the supplies we need to build the house. So you eat the food, that's the supplies you need to build the house, but it comes on the truck, it's all together, so you got to break it down, break it in little pieces, so you got one board at a time as you begin to hammer them together. And that's the way that your metabolism works in your body, and vitamins and minerals can be very helpful in how you utilize your foods. So vitamin B3, a lot of people heard of that one. That one is niacin. I use niacin a lot when a person's having a challenge with cholesterol. If their cholesterol is high, particularly the LDL, then sometimes niacin can help bring that down. I recommend the anti-flush niacin, and if you can get up to between 2,000 and 3,000 milligrams a day, that's probably going to be your more optimal dose. But the biggest side effect of niacin is a flushing, like a hot flashes. So your face may become red and flushed and hot. That only lasts about 15 or 20 minutes, and it's not a big deal. It's not a problem why you need to stop taking niacin. It's a problem why some people will stop because they don't like that sensation. So if you're going to take niacin, try the anti-flush. There's some things sometimes you can do to make it more palatable, to make it where you don't get that. But many times I think just trying one of the different preparations that suggests it's an anti-flush one might work for you. So, and again, I usually start on 500 milligrams a day, and I work my way up to 2,000. I may go up to 1,000, 1,500, 2,000. Keep going maybe to 3,000 if they're not still having the flush symptoms, to try to maximize going after that cholesterol profile. Now, your HDL, that's your good cholesterol, and your LDL we refer to as your bad cholesterol. It's much more complicated than this. You have the particle size and things like that, but I'm not going to get into that because most people don't know anything about the particle size, but a lot of people have heard the good cholesterol and the bad cholesterol. Well, the good cholesterol you increase by exercise. The bad cholesterol you decrease by getting rid of the fats and the sweets. And niacin can also help decrease the bad cholesterol. Increasing the good cholesterol, the niacin may help just a little bit. There's not a lot of things on the market that are going to increase your good cholesterol. Some of your cholesterol medications may increase your good cholesterol ever so slightly. But I would suggest one of the best things on the market to improve your cholesterol profile will be BioSlife. So if you go by my website and look on my website and go click on BioSlife, that product has 2 patents to lower the serum cholesterol, and it also helps stabilize the blood sugars. So for those people that like to do things naturally, that's actually my product of choice to treat patients' cholesterol and diabetes. It's very effective, and just as effective as some of the medications. Particularly in raising the HDL, it probably is more effective in raising the HDL probably than most medications on the market. So that's a very competitive product in helping with that. And because it's high in fiber, it's also very effective in weight management. So a lot of times when a person's taking BioSlife, they also lose weight. And so what happened is the company, after they saw that was one of the frequent side effects, they tweaked the formulation a little bit, so now the formulation actually can be used for weight loss as well.
Okay.
So that's on my website. Just go AskDrFerguson.com and look up BioSlife. And there's several different derivatives of that. There's Slim, there's Natural, there's a lot of different versions of that. They aim at a little something different, but all of them are going to be effective in helping to lower the cholesterol, increase the good cholesterol, decrease the bad cholesterol, and helping stabilize blood sugars. Can lower hemoglobin A1C as much as 0.9. Most people probably have effects somewhere between lowering hemoglobin A1C, maybe 0.4, 0.5, increase in the HDL by 15 to 20%, decrease in the LDL by 20 to 30%. So very effective product. Taken every day as a supplement. You take it about 15 minutes before your biggest meal each day, and it can be very, very effective. So that's something that can help with cholesterol. So back to the vitamins. Again, you can find that on my website at AskDrFerguson.com. So the niacin, again, I use that a lot of times with helping with the cholesterol profile. It also helps with the skin, helps with the nervous system, helps with the GI tract to be healthy. Niacin, different amounts are recommended. The daily recommended allowance is 220 milligrams. But you just heard me say I give a person anywhere between 500 and 3,000 milligrams, where 20 milligrams was the daily recommended allowance. Next, B5. Not a lot of people heard of B5, but that can help with metabolism of your carbohydrates. That's your sugars. Your carbohydrates are a long-chain sugar, and then that breaks down, when it gets in the body, it breaks down into simple sugars, which then your body can utilize. It also helps with fat and protein metabolism, and it's involved in, one of the key factors involved in those metabolisms is the B5. B6, it's another one, helps with amino acids and fatty acid utilization in the body, helps with the blood vessels, helps with red cell production. B7, biotin, a lot of people may have heard of that. Again, all of these are going to help with the energy production, but biotin may help more with the hair, the skin, and the muscles. So you can see they all do something similar, but then they have a little other things that they do more specifically. B9, people have heard of that. That's folic acid. Baby, that's all of your prenatal multivitamins are going to have folic acid, because folic acid we found to be helpful in development of the nervous system, helping prevent some of the birth defects that would involve the nervous system, where B9 comes in. So that's going to be in any of your prenatal vitamins. Necessary for growth of the cells, production of your cells as the baby's growing inside. And B12, a lot of people heard of that. They hear about B12. It helps boost their energy, helps the nervous system, helps to synthesize some of the different compounds in your body. The energy is probably the place that people hear B12 most. And you can have your B12 level checked by your healthcare provider, and if it's normal, there's no reason to take it. There's no reason to get an injection. There's no reason to take a pill for it. I mean, if you want to take a small dose on a daily basis, 6 micrograms is the recommended daily allowance, but people can give up to 3,000 milligrams a day. Generally, when I'm going to treat a person, I might give them 1,000 milligrams, maybe once a week, depending on how low they are. They might give them 1,000 milligrams once a month in injection. This depends on what your goal is. A lot of weight loss clinics have put B12 into their equation. I'm not convinced that it's doing anything if your B12 is already normal. So it doesn't hurt to check your levels. You can check most of your vitamin levels. You can ask your doctor to do that. B12 will be a more common one to check. Folic acid will be a more common one to check. Those are common too that we frequently might check. And when you check it, if you're in the middle of the normal range, then I wouldn't see any reason that you need to take more. If you're the low end, you might want to take more to push yourself towards the upper end. But those are things that can be monitored, and I think B12 has gotten a little too much hype to it. People think, well, my energy's low, so I better take B12. Well, if your energy is low and your B12 is low, it might be effective. It might help. But if your B12 is normal and your energy is low, it's not going to be very effective. So just as a side note from there, when a person's energy is low, my experience has been it's much more a hormonal issue. And so what I do when a person complains of fatigue, rundown, depression, difficulty sleeping, all those types of things, I'll check their hormone balances, and I check it with saliva testing, which you can find on the link page on my website. I usually use ZRT Labs. I do saliva testing, I get back the numbers, and we treat accordingly. And once we balance a person's hormones, we almost always eliminate that fatigue factor, the rundown, difficulty sleeping, painful periods, hot flashes, night sweats. All of those things can be very effectively eliminated or treated when we get the hormones in balance. So that's been much more what I have found in my practice over the last 28 years, that when a person is having fatigue, rundown, worn out, lack of energy, a hormone imbalance is often the problem. But it could be many other things. It could be related to the thyroid, which is again is a hormone. But it could be related to being anemic. Maybe they have really heavy periods, so maybe they're shedding so much blood monthly that they're behind on the fluid, on their hemoglobin, so they're not carrying enough oxygen around to the tissue. So many different reasons that can happen for. But my starting point in my office is hormone balancing. So those are the B vitamins. C we talked a little about last week. We talked about vitamin C being one of the strongest antioxidants that we have, and that's a very important one to utilize. I recommend 1,000 milligrams twice a day. When an antioxidant means it's going to help eliminate the free radicals. Again, free radicals is a cell that's functioning abnormally. The electrons around the cell, it's lost one of those electrons, so it's kind of a loose cannon. And you bring the antioxidant in, it gives it that electron back, and then it's functioning back in the normal way again. So antioxidants are very important, helping fight against cancer, helping fight against infection, just helping you feel good in general. Vitamin D. A lot of people are deficient in vitamin D. Vitamin D comes from, it's needed for your bones. You get it from the sun. You get 15-20 minutes of good sun each day. You should get a fair amount of vitamin D. Vitamin E. Again, that's an antioxidant. It helps with cell growth, red cell production, helps in preventing against blood clots. Vitamin K, same thing, helps prevent against blood clots, works in the liver. So just kind of running through some of these relatively fast so we can have another topic next week. Zinc, a lot of people hear about zinc. That can help in the healing process, can help with your eyes, can help with your taste buds. If you're having problems with your smell, your taste buds, zinc might be helpful in that category. Selenium is one of those ones, a real strong antioxidant. That can be very helpful when we're talking about some of your protein utilization in your body. It also can be helpful in utilizing it with vitamin E. Magnesium works really good when you're trying to get your bones stronger. Calcium, magnesium, and vitamin D, that combination can be very helpful in strengthening the bones. So those are a few of the ones out there. There are others. Chromium is one I use a lot in the office. I use 1,000 milligrams of chromium a day to help stabilize the blood sugars. So when I'm treating a patient and they're showing that they're having beginning signs of diabetes, maybe their hemoglobin A1C is 6.0, which represents a sugar of 120. Diabetes starts at 126. I'll probably put that person on chromium. And many times we're able to maintain them for several years with maybe the hemoglobin A1C not getting any higher. Maybe it might drop down to 5.8. But the fact that we're able to maintain them for several more years without starting a blood sugar medication, I think that's very effective. And chromium is a mineral. So the way I do that is, again, have you take 1,000 a day, but also talk to you about diet, exercise, lifestyle changes. So it's not just going to be about taking the chromium and all of a sudden things are great. You need to do other things as well. I'll come back to some of these in a moment, but I don't want to forget to tell everybody, don't forget to tune in today to Talk Back Now. What is it, Talk Back Now or Talk Back Live?
Talk Back Now.
Talk Back Now with Patricia Ferguson. That's my wife. She does a program from 11 to 12 on Mondays and Wednesdays, and then on 10 to 11 on Fridays. But today she's going to have a special guest. She's going to have Dr. Cedric Bright on there today, and they're going to be talking about health disparities. And health disparities are the difference in health care that one might get if they're African American or if they're Caucasian. or if they're Indian, or if they're Hispanic. Those are what we call health disparities. And you all should find that topic very interesting. Dr. Bright is he's assistant dean at University of Chapel Hill right now. He's past president of Old North State Medical Society, as well as the National Medical Society, which is the largest organization of black physicians in the country. So I think you'll enjoy hearing from them. I think they'll have a very spirited conversation. So don't forget to tune in to her today on that program. That should be a very, very good in education. When you talk about health disparities, say diabetes. African Americans get more diabetes. Hypertension. African Americans get more hypertension. Alzheimer's disease. African Americans are more likely to Alzheimer's disease. High cholesterol. So African Americans have several things that they're much more prone to get than others, and they'll talk about some of those things. Why is that? Is that because of health care was available or wasn't available, the eating habits, the exercise habits, genetics? So they'll get into some of those things, and I think you'll find that conversation very interesting today. Always, you can reach me at my website at AskDrFerguson.com. You can always call my office at 252-332-6484. We're always happy to see new patients. We enjoy seeing patients of all types, shapes, and forms. But we enjoy Alzheimer's disease. We do a lot of weight management, hormone balancing. Those are some of the things I probably enjoy more than others, but I enjoy taking care of the whole family in general. So those are ways you can reach me. You can also always type in my name on the internet, Stephen Ferguson, MD. You'll come up with several pages of things I've done or places on the internet. A lot of people enjoy my YouTubes. I have about 170 YouTubes on the website, and they're all aimed at an educational point of view. I have a group on Alzheimer's disease. I have a group on hormone balancing. All of these radio programs will get archived on there as well. So if you miss one of these or want to go back and hear something I've said, you can go to my website, youtube.com/user/AskDrFerguson, and you'll be able to listen to all the programs that we've broadcast on the internet. They're all archived there. You can another section on Suboxone, which we use for detox treatment. Patient is hooked on drugs, so particularly narcotics. We don't have anything for cocaine at this point, but I think they're working on it. Cocaine and alcohol, or the alcohol, we have a few things, but cocaine, nothing per se that really works. But medicine might be out in the next 1 or 2 years that might be very effective for that. But opioids, that would be your Percocets, your methadone, your Vicodin, your Lortabs. Those are all in the opioid category. That's where we have a clinic for that. But also on my website, I have multiple YouTubes on that topic. Another section, I have a Passion Cam. That's where I put my video camera on my dashboard and I just talk while I'm driving. And there you'll find a lot of different topics, but there's a lot of topics there on detox and withdrawal and just anything positive. All of those are like a word for the day. All of those are going to be something positive, something can be uplifting, can encourage you on that particular day. And so I encourage you to go to those different places, and you just go by the website and you'll find lots and lots of other stuff there. And some of you also know that lastly, I really love photography, and a lot of my photography is on my website at photomedoc.com. But that's just kind of as a side note that a lot of you will enjoy doing that. If you have children and playing in the sports and here locally, if I'm at a sports game, I usually have my camera, and I'll probably take the pictures and they'll be up there on the website. So some of you may have grandkids that you've never seen them in uniform, you've never seen them playing, or go by the website and look it up. And if they're playing against Bertie, those are the games I usually photograph. And then basketball, football, you might find your kid or your grandkid in uniform there. So that's another good source to maybe connect with some of your young people.
Alrighty.
All right. So on that note, to our listening audience, both locally and internationally, I want to say be blessed and have a wonderful day. All right. Bye-bye now. And those of you who are coming to us on the broadcast live, tell your friends about us. We do this weekly from 9:30 to 10 on Wednesdays. We archive all of the events, so you can always come back and listen. But we see we're getting more and more people that are joining us each week, and we encourage you to tell your friends about it. We try to provide some preventive health care information that you can utilize immediately. And that's what it's all about. We want to give you something that you can work with and help improve your overall health from a preventive healthcare point of view. So Be blessed and tell your friends about it. And now, when you go to my YouTube site, if you subscribe, then you'll get an email each week letting you know the program is getting ready to go forward. So go by youtube.com/user/AskDrFerguson, subscribe, and then you can get you'll get an email each week. And when we get enough subscribers, we'll be able to actually have our own channel, and it will be easier for you to get into and watch this, as opposed to like today you have to go through the youtube.com. There'll be a much easier link to do this once we get enough subscribers that are subscribing on a weekly basis. All right, so be blessed. Have a wonderful day. We'll see you next week at the same time. All right, bye-bye.